I'm Allison Kuipers. I'm a board-certified pediatrician. I am from Northern Palm Beach County.
I'm Dr. Amanda Thomas. I'm one of the pediatricians here at Palm Beach Pediatrics, part of Bluebird Kids Health.
I'm Shannon Fox-Levine. I'm a pediatrician, and I've been a pediatrician now for over 20 years.
What I love about pediatrics is that there is a built-in team for every patient. I like to think of my role as a pediatrician and being the partner for the caregiver, and just being able to use my knowledge and my expertise to help them make a decision and think about what's best for their family overall.
I love working with kids because they make me laugh. There's not a day that goes by that I don't have somebody saying something ridiculously silly and funny that makes me crack up during a serious exam. It just kind of keeps me going.
The best part of what I do is really becoming that extension of the family. And as we know, with everybody, it takes a village, right, to get where we need to be. And being a part of that village for so many children through the years is really, really rewarding and just makes me feel like I've made that difference.
I try to make kids feel the most comfortable by talking directly to them, trying to give them some agency and letting them answer and participate in their health decisions. I try to enter the room smiling and with a fresh, clean slate, because I think every appointment is a chance to make new goals and start anew, and just trying to meet everyone on the same page. And so I think and hope families and children appreciate that.
I practice evidence-based medicine. I provide parents with the recommended guidelines, but I'm also a little bit flexible in certain ways to where I know it's not going to come right away, or certain things are not black or white. There is maybe a little bit of a gray zone. I try to do a good job about reading the room and seeing what would make that child comfortable. Depends on the child, everybody's different, right? Some kids are walking in, smiling faces and happy to be there. Others are terrified. So I kind of just do my best to make them feel comfortable in ways of, like, for the little ones, sometimes you might hear me down the hall, I'm singing The Wheels on the Bus and Twinkle, Twinkle, Little Star. And oftentimes that really helps them to feel comfortable, and they tend to kind of let down their guard a little bit.
Our goal is being a pediatric medical home, which means we treat the whole child, mind and body. And so you don't need to go to multiple different providers to get the care that you need.
My kids are patients here, and they love to see their pediatrician. They love to walk in the doors. They're happy to be here. And that, to me, is so special, to know that the place that I work and the place that I spend a lot of my time is a place that welcomes them too.
We have staff who've been here 30 years. And the reason they're here is just for that, is to make the difference for every child. That comprehensive care being the root, and care coordination, helping those who really need the help. Not everybody needs hand-holding, but there are a lot of families who need the extra hand-holding.
I like to finish my exam by saying, like, oh, your child is perfect, because they are, they are perfect.